two FDA-approved GLP-1 medications, Wegovy pill and Foundayo. Yes, sounds exciting. Now, before I jump into the pill option, I wanted to tell you that it is not in last 6 months. We've had the first GLP-1 pill, that is Semaglutide pill, FDA approved around in 2019 for type 2 diabetes. It's still available. Now, the next exciting part for this episode is number 2, that is Foundayo, the next oral pill, which was FDA approved April 1st, 2026. And this is a different ballgame, a different animal by itself. It is not a peptide. What if you could get the benefits of GLP-1 medication without injecting, without those needles, without that stinging sensation, and without the weekly shots? Yes, my friend, it's possible. And science has been rapidly evolving in this space of GLP-1. And today I'll be sharing a breakdown of 2 important oral GLP-1 medications that have been released in the last 6 months by the FDA, and a simple breakdown in the next 15 minutes. So stay tuned with me. This is your host, Dr. Chhaya Makhija, a triple board certified endocrinologist and lifestyle medicine specialist, building a platform where I can, along with many other physician experts, break down science in a simplified manner and always never forget about lifestyle. Before I jump in, I want to request you to stick with me till the end. The reason is because I'm going to share something even more important, is the clinical application of these 2 new agents, that is oral GLP-1, in the clinical world. What questions to ask your clinician, your physician, if you have been thinking about this medication. And also, if you're considering it, you don't want to miss the last part of this episode. All right, so let's jump into it. 2 FDA-approved GLP-1 medications, Wegovy pill and Foundayo. Yes, sounds exciting. Now, before I jump into the pill option, I wanted to tell you that it is not in last 6 months. We've had the first GLP-1 pill, that is Semaglutide pill, FDA approved around in 2019 for type 2 diabetes, and it was called as Rybelsus. It's still available. It was in lower doses as compared to what the Wegovy pill we have now. But it did not show as much of an efficacy or benefit for the glycemic control in type 2 diabetes patients. So as endocrinologists, we haven't used that as often as compared to the injectable GLP-1, which are also FDA approved for type 2 diabetes. Okay. Number 1 is Wegovy pill. Is the same as the semaglutide pill that we've had in since 2019, but higher doses, and it's called Wegovy pill. The FDA-approved indications are also different. It's not necessarily for type 2 diabetes, but it's the same indications as the injectable Wegovy that you all know about, which is obesity based on the BMI criteria, overweight based on BMI criteria, with at least one comorbid risk factor. Now, Wegovy is also FDA approved to reduce the MACE events, the MACE risk factors, and that is major cardiovascular or atherosclerotic cardiovascular events. And the other are pediatric obesity. Yes, so greater than 12 years of age, we have the approval for Wegovy, and then MASH, or previously known as fatty liver disease, and now it's termed as metabolic associated steatohepatitis. The second pill that I will be sharing is Foundayo, which is a more recent FDA approval in April 1st, on April 1st, 2026. And while I'm recording this episode and while you're going to listen to this episode, we are still in the month of April of 2026. So it's fresh, new, and as we learn more in science about all of these innovations and clinical relevance, I will be sharing this even in the near future episodes. So Foundayo, coming back to the second oral GLP-1 pill. So the approval for Foundayo was for excess body weight, maintaining body weight reduction in patients with obesity, again, BMI category or criteria for greater than 30, or overweight with one obesity-related comorbid condition. So that you should be discussing with your clinician, which could be prediabetes, it could be diabetes type 2, it could be hyperlipidemia, it could be sleep apnea, and so on. So that's a great discussion to have with your clinician while you are looking into submitting it for your treatment. All of these medications are been studied in association with changes in nutrition, and they're terming it as a reduced caloric diet and, of course, increased physical activity. Okay, so now step 2 is going to be looking into these clinical trials as an overview, and I'm again going to simplify it for you. All right, let's break down Wegovy first. So Wegovy pill, December 2025, when it was FDA approved for the indications that I just talked to you about, it also has a dose escalation. So you could literally start from 1.5 milligrams, go up to 3, 7, 14, 25. You also have the studies for 50 milligram, but it's also, again, how your patient is tolerating. The pill form is a daily pill intake. There are specific instructions for the intake of this pill. One is take it on an empty stomach with no more than 4 to 6 ounces of water. The next one is swallow the whole pill. Do not crush it, do not chew it, do not cut it. And you have to wait for at least 30 minutes for any beverage food that you're going to eat after, given the restrictions and how this medication or pill is being absorbed. Now, these restrictions exist because semaglutide has lower bioavailability when it is in the oral form. The molecule for Wegovy pill is exactly the same as the injectable semaglutide molecule. It has a low bioavailability, and in terms of numbers, 1 to 2%. So whatever you're taking in, 1 to 2% of it gets absorbed. And hence, just to give you a comparison, the Wegovy injectable, for example, it's 1.7 or 2.4 milligram. The injectable form is way lower in terms of doses as compared to the oral doses, which are 25 to 30 milligram. Now, what does a peptide meaning? That is, if you are taking your pill with food or with liquid, it goes into the stomach and it gets degraded very rapidly, and that impairs the absorption, and that leads to, not appropriate absorption of that Wegovy pill, and you're not going to see the benefits or the effects. The next part is the half-life that you should also be aware of. It's a daily pill, it's not a weekly pill as compared to the injectable Wegovy, which is weekly. The half-life, that is how long it stays in your system, is around 7 days to a week. Now, it is very identical to the subcutaneous injectable Wegovy form, as I've discussed with you, but it's just a route. You're taking a pill instead of injecting it subcutaneously. So, in terms of figuring out when you're going to get the steady state, when you're discussing it with your clinician, give it at least a few weeks, 4 to 5 weeks, based on the daily dose. The next part that you should be aware of is the formulation and where it is traveling into your body and how is it excreted. So again, we are still talking about the Wegovy pill, which is peptide. That is, it can get degraded very easily in the stomach, and that's how there are certain restrictions or instructions on appropriately taking this pill to see the maximal benefit. Now, how is this done? That's very fascinating and interesting, is that it is co-formulated in a tablet form with something called as SNAC, which is, I'm going to read this out to you, sodium Na2-hydroxybenzole aminocyprolate. You don't have to remember this, but it's basically an enhancer, a SNAC, which helps to change the local gastric, your stomach pH, so that the transportation of the GLP-1 peptide, that is a molecule, is more seamless in the gastric lining or the epithelium. And the reason for those instructions that your clinician is giving you about the water and about avoiding food for those 30 minutes is that enhancer, which is helping the tablet to get absorbed better. It works effectively or if there is no food or no interference from the food in the gastric lining. Gastric is, again, your stomach. Now, the next part is what is a weight loss? What are we actually seeing in the clinical trials? Since Wegovy pill was FDA approved in December 2025, we have the clinical trials, which were also published in New England Journal of Medicine around 2025. So I'm sharing just the primary endpoint or what exactly was the average weight loss reduction with Wegovy pill, that is a semaglutide pill. And this was 2 trials, one was 25, one was 50 milligram, but on an average, there was around 13.6 to 15% of weight loss based on the duration of the trial. The duration of trial was around 71 weeks for Wegovy 25 and around 68 weeks for oral Wegovy 50 milligrams. Another thing that you need to remember is that when these trials are conducted, it is against a randomized controlled trial. This is comparing placebo. So it's not comparing the injectable form of any GLP-1, or this is not a comparison between one GLP-1 pill to the other. They're independent studies and it is being compared to the placebo. So when it says 13.6 to 15% of the weight loss in that duration, if someone was weighing 200 pounds, then the 15% would be around 30 pounds of weight loss for that particular individual while on the maximal tolerated dose. Okay, so that's all about the Wegovy pill. Another important thing that you would want to know before I jump into the next oral GLP-1 is the dose escalation. So you're going to meet your clinician and you want to have a discussion that is Wegovy pill right for me, and we'll be talking about that at the end of this episode in terms of the questions or Q&A with your clinician. It is very important that all of these medications in general for GLP-1, there's always a low dose, which is the starting dose, and then there's a gradual up titration or escalation, usually every month, but it is also dependent on your clinician. So based on what the FDA approval indications and the usual protocol is, you start with a low dose of 1.5 milligram Wegovy pill once daily, and then you can go up to doubling it 1.5, 3, 7 milligram, 14 milligram, 25 milligrams, and so on, and then come to a maintenance. I talked to you about the strict restrictions of how to take this medication and also the bioavailability, that is, the available drug after it is being absorbed. And that's why the doses are very different compared to the injectable form of Wegovy. I'm not diving into contraindications or reasons that these medications are not absolutely taken. These were already discussed in my previous episodes on GLP-1. So you can watch that episode or tune into that episode to learn more about the contraindications, or even read through the actual FDA approval or read through the actual FDA guidelines about this pill and talk to your clinician. All right. Now, the next exciting part for this episode is number 2, that is Foundayo, the next oral pill, which was FDA approved April 1st, 2026. And this is a different ballgame, a different animal by itself. It is not a peptide, meaning it is a synthetic molecule, more like a traditional pill that you've been using, say, for your blood pressure management or even for your cholesterol management. Hence, the bioavailability, that is the available drug which is going to be effective in your circulation, is going to be higher, around 40 to 70% after the oral intake. Now, the exciting part about this is that there is no fasting required, there is no water restriction or food restriction, and it could be taken any time of the day. But there are a lot of differences. Again, when I'm talking about the clinical trial for Foundayo or the Orfoglipron, it is the trial conducted for individuals where they had people taking placebo versus Foundayo. FDA approved indication, we've already touched base, which is mainly for weight management. Okay. Now, why is this important? Flexibility matters, especially patient adherence. And again, stay tuned until the last part of the episode as to why I would discuss a specific type of the oral GLP-1 and what kind of patients to bring about that discussion in my clinic. Okay, so Foundayo, what is so fundamentally different about this oral GLP-1? It's a non-peptide, it's synthetic, it's a small molecule. It's still GLP-1, but I'll explain that it is not a full GLP-1 receptor agonist. The good thing about small peptide and synthetic is that it is resistant to that degradation that is happening in the stomach and the upper gastrointestinal tract. And that's why remember the snack, the absorption enhancer that I was talking to you about in the Wegovy pill, that does not need to be in picture for this synthetic pill. Again, its bioavailability is higher. There are ranges. Again, this is a very new drug, so all the information that I have is what I'm sharing. It could be 20 to 40%, and in some data I read, it's around 70%. Now, this becomes very important because the bioavailability, that means the available medication to bring about an effect, is definitely higher than the oral semaglutide. Now, how does this work pharmacologically, right? So, in science, as clinicians, we really want to know that what is happening when the patient takes in the drug, where it's going through liver, kidneys, or what's happening in the gut. Are there any drug interactions if taken simultaneously with any other drug? And then how is it excreted? So that's the pharmacokinetics of the medication. I'm not going into the depths of it, but you should at least know that it's selective, it's high affinity, partial agonist of the GLP-1 receptor. What does that mean? That is, the GLP-1 receptor is present and in our bodies, in our multiple cells, and it is a partial agonist, meaning it doesn't have 100% effect as a GLP-1 molecule, which is a peptide, because that fits into that receptor really well and becomes a part of it. This is partial agonist, meaning it does not conform exactly to that particular receptor, but it brings about a similar action once it's attached to that receptor. So the differences, there will be differences in what about the results it's bringing about. And in terms of, again, simplifying the translation, the weight loss that was seen in clinical trials is around approximately 11% and plus and minus as we learn more about in the data and depending on the doses. Okay, so now you know both about both these drugs. They both are oral, they both are going into your gut. The side effect profile, the oral pills in general tend to have just a tendency of more common adverse effects for the gut, for the gastrointestinal system, like nausea, vomiting, diarrhea, and constipation, as compared to injectables. Again, we don't have head to head studies comparing the injectable with the pill, but as we learn more, I will be sharing more with you. But no doubt, because they're GLP-1 receptor agonists, they will be causing adverse GI events. Hence, the dose escalation becomes very important, the dose titration, guiding you through specific discussions on protein, fiber, avoiding that fat intake, avoiding late night eating, how to rely on and making sure consistency of your water intake as well as bowel movements is all going to help you mitigate those adverse effects. The last part is, again, it's very important to discuss with your clinician that these are available. I know many of you would be interested that if health insurance or your medical health insurance is going to cover it or not, and that's a great discussion to have it with your clinician. Foundayo is still new. It's April 1st, 2026 when it was FDA approved, so we'll learn more about its cost. But that also has a dose escalation of 0.8, and then you go up to 2.5, 5.5 milligram, and they have these series of tablets for the adjustments. Again, no restrictions in terms of how you take the pill, and that's how there is the major difference in the molecule of Wegovy pill versus the molecule of Orfoglipron. The last part is, how am I going to discuss this with my clinician? I talked to you about the bioavailability, the gut absorption, if you have needle phobia, as well as, what is your medical indication. Where I feel that it's going to be beneficial in many of our patients is as individuals have been taking injectable GLP-1 medications and now they've achieved their health goals. Again, health goal, as I've discussed, is not just the weight on the scale, which is either pounds on kilograms. I dive into this a lot in my previous episodes of GLP-1. So take a look at that because you should be knowing why body composition, why your visceral fat, why your muscle mass is so important for your health rather than just looking at the weight in pounds or in kilograms. Once we figure out that the patient has achieved or very near to those goals, that is, healthy muscle mass, they are working on their lifestyle, they are tolerating, and we've been able to wean down the dose. In many patients, the maintenance dose could be possibly switched from injectable to the oral formulation, like the Orfoglipron. I'm not sure if that could be similar with from injectables to Wegovy, but possibly from Wegovy injectable to Wegovy pill if the patient has achieved a great health goal and now you're looking at maintenance and also reducing or mitigating the gastrointestinal side effects. But that again depends on patient, individual absorption. There are other medical comorbidities, if they have any background reflux versus not. And that's how you would decide if it's worth discussing with your patients or you as a patient discussing with your clinician if oral GLP-1 and then which formulation would be worth considering in my case for my medical history to achieve my health goals versus just considering as a maintenance dose. Again, this is all new data, and I'll be sharing more in terms of the clinical relevance, clinical expertise. Before I end the episode today, it's a disclaimer that there is no personal medical advice being relayed on our episodes or on our shows, and the same goes with today's episode. So you're getting the right knowledge and awareness. Go get the right resources. I'll put some resources in the show notes, including the studies that have been done. And stay tuned for our next few more episodes on this topic. You can also follow me on Instagram, on YouTube at Chhaya Makhija MD. And if you've been enjoying these episodes and the wealth of knowledge being shared with multiple other physician experts as they come along and share the science of medicine and simplify it for you, please like and subscribe wherever you're watching our podcast, Hormones and Hope. Share it with someone who has been questioning or figuring out if GLP-1 medications are appropriate or not appropriate for them. And you might change their entire conversation with their clinicians. Until then, stay happy and keep your happy hormones elevated. Signing off.